Our first speaker after lunch, basically our second to last speaker actually is Dr. Deborah Lambie, who, besides working as a doctor in Wellington Hospital, she's also the chair of the Doctors in Training Council, a member of the New Zealand Medical Workforce Task Force Governance Group, and the co-founder of LearnCoach, a charitable trust that was established to help students with NCEA and now Health Sci as well. As well as being a past team member of NZMSA, Deb has also represented New Zealand as Miss World in 2015. So could we all please welcome Dr. Deborah Lambie.
Thanks, guys. Awesome to be here today among fellow trainee doctors. I still think of myself as a trainee because once you finish med school, you realise that you don't really know as much as you thought. So anyway, I'm a fellow trainee doctor, like all of you. So awesome to be here today. And I'm going to talk a little bit about what I view clinical leadership as and share a few stories with you. And so I thought of a few things that I see clinical leadership in, and I'm going to tell you a story about each of them. Hopefully they won't put you to sleep after lunch. So we'll see how I go. If you do start falling asleep, I will call you out. I think leadership is being involved. Leadership is standing up for our patients even when it's not the easiest thing to do. Leadership is learning from others and leading change. Leadership is carrying on despite setbacks, and leadership is being proactive. So, yeah. You're going first, guys. As Gisela said, I'm the current chair of the New Zealand Medical Association Doctors in Training Council. And for me, that means that I go to quite a few meetings and try to represent the view not only of doctors in training, but I also see you guys as fellow doctors in training, as I've said. And sometimes it feels like I'm at meetings that are like Trump signing this abortion bill. Not very diverse, lots of men in suits, and people making decisions about doctors in training that aren't doctors in training. So I always try to go along, try to say my opinion, and try to make sure that we have a voice. And I was recently at a meeting that was about changing the way that feedback is done for PGY 1 and 2s, and I was the only person in the whole meeting that was under the age of 50, and this is the feedback that's going to be affecting me, my colleagues, and all of you. So I think if all of us can try to be as involved as possible in the decisions that are making that affect us, that affect our colleagues, then that will mean that we have a say in these kind of things, and I think that's really important. Okay, so the next thing about leadership is that leadership's about standing up for our patients. And when I was at med school, was kind of ripped out as the person that passed out more than anyone in the whole class. I passed out in caesarean sections at 5 in the morning on my O&G nights when I was the only person assisting. The first time I tried to put a line in ED, the emergency bell was rung not for the patient, but because I passed out on the floor. And then after my first attempt to put an IV line in ED, I was on the ward trying to put an IV line in, and I remember being really nervous because the first one had gone so bad. I was worried that I would faint, and then I was kind of shaking and trying to take the cap off the needle, which is a bit embarrassing, and the patient was like to me, "Oh, is this your first time?" And I was like, "Nah, last one went fine." And then I went and I put the needle in, and then the patient's eyes rolled back in his head and he started having a seizure. and then I pressed the emergency bell, and then the patient was like, "Ha, got you." I know. It's actually happened. Yeah. Oh, anyway, yeah. And the patient thought this was so hilarious. He got out of the bed and did this kind of stupid victory dance. And his patient hospital gown with the back showing everything. Anyway, I'm much better now. I can put IV lines in without any problem. I can haven't passed out since I had my blood taken quite recently. But But yeah, I'm much better now. And so I'm working as a second-year house officer in Masterton. And for those of you who don't know, and I didn't know until I went there a few weeks ago, it's an hour and a half kind of like up from Wellington over this really, really windy road. And it's a little bit of a scary place to work because after hours, there's you and one other house surgeon who's equally like junior. And you man the ED and you see the ONG patients, the PEDS patients, the surgical patients, all the patients, you see them. And I started the run, my first shift was a night shift, so I'd never been in the hospital. And 5 T2 patients came in at about 5 o'clock, at about kind of, this might be like just before midnight. And a T2 patient is someone that has to be seen within 10 minutes. And so me and the other house surgeon were like, oh shit. and I had the pleasure of seeing a drunk gentleman who'd very unfortunately had his face set on fire with petrol by his friend, which was pretty, it was not very good. Not a good night for him. Sorry, it's really inappropriate. But so there were all. It was kind of stressful because there was a patient who had come in with massive melena and was hypotensive. There was a patient that had chest pain. I think I had this guy, and there was 2 other patients that really urgently needed to be seen. So this guy, I did like all the right things, got it cooled, rung HUT. They accepted the patient for transfer, so we were all set up to get the patient transferred by ambulance urgently to HUT because he needed to be looked at. sorry, but I rung that, and the patient had really bad facial burns and also really bad neck burns all over his lips and up his nose, and so that's quite a high risk airway. And the doctors at HUT were like, you have to get the airway checked by an anaesthetist before you put the patient in the ambulance. And so I was like, that's fine, I'll ring the anaesthetist. So I rang the anaesthetist and he was like, not going to come in. And I was like, I think it's really important the patient won't be accepted for transfer unless you come and review the airway. And he was like, nah, I'm not going to come in. And I was like, okay, so hung up the phone, and then I rang the surgeon because if the patient was going to stay, he'd have to go under surgery. And he was like, oh, you should probably just get the patient sent away straight to the HUT because they probably shouldn't be admitted under me. And I was like, oh, but they need to get the airway checked. And he was like, oh, it's not really a problem. So then I rang the HUT again, and HUT was like, and I talked to both the doctors, the senior doctor at the HUT, and he was like, you can't put the patient in an ambulance without getting the airway checked. And I was like, okay, I'll ring the anaesthetist again. So I rang the anaesthetist again, and at the same time, there's these 4 other T2 patients that my other house surgeon is trying to see, who are really sick as well. And I rang the anaesthetist, and he was like, no, I'm not going to come in. It's not really appropriate. And so anyway, I had to really escalate this, and I was like, well, I'm not putting the patient in an ambulance with a nurse who doesn't have airway skills. And so eventually the anaesthetist came. He thinks I'm like a huge troublemaker and a terrible person, and he made snarly remarks about the ED, but the patient got seen and the patient got safely transferred to the HUT. And so I think that leadership is standing up for your patients even when other people don't think that it's right. And I was like, what would have happened if we had put him in the ambulance and he'd had delayed swelling of his airways and then he died? That's terrible for him. I would be on the line. And the anaesthetist is paid much more money than I am to come in and do his job. So he came in and did his job. I don't think he likes me, but that's all right. And I think leadership is also not just standing up for your patients, but probably feeding that back to someone, because I don't want that to happen to my colleague. I don't want that to happen to another patient who comes in and needs the airway reviewed urgently. And I would like to see that changed. So I think what we need to think about as medical students and as doctors in training is when we see things that happen that make us really uncomfortable or practice that we think is unsafe, it's really worth standing your ground. Sometimes it's worth going with the flow if things aren't that important, but if someone's life is going to be in danger or your career would be on the line if something went wrong, you have to stand your ground and then feed it back so that other people don't end up in the same position. So, standing up for your patients. Oh, and that I just put that in because if I'd followed the anaesthetist lead, that could have been my career down off the cliff. Okay, and so next point, leadership is about learning from others and leading change. And so when I was, I think, in second or third year of med school, as Gisela said, one of my friends was like, oh, you should have a go in one of these competitions. And I was like, oh, that's a really stupid idea. And then I talked to my mum and dad, and they were like, you cannot do that. That is such a terrible idea. They were like, we can't think of anything worse than you entering a beauty pageant. And I was like, oh, okay, I'm going to do it. And I can really, in some ways, really understand where they come from, where my parents were coming from, because one, med school is much more important, because you need to have the skills and actually turn up to class so that you know what to do when you start working. But then two, I think in the past, these kind of competitions have come from a place that is probably really bad, and these kind of competitions haven't been something that you'd want your daughter or your child to enter in. But the competition that I entered is very different from the one that's run by Trump, which is good. And this had no bikinis on stage, and it's much more about leadership, about charity work. And I really enjoyed it, and I ended up, I don't know how, but I ended up winning the New Zealand competition. And then going to China to represent New Zealand at Miss World, not last year, but the year before, which was really weird experience, but really awesome. And I don't know if any of you heard about kind of the media kerfuffle that happened to me, because so when I found out that I had to represent New Zealand at this competition, one of the things that every contestant has to do is a cultural performance. And I was like, well, I don't have any skills in kapahaka, and I don't really know what to do, so I will go to someone who does. And so I went to a lecturer from Whitireia in Māori Performing Arts called Kiriyama, and he was awesome. And he watched the cultural performances from the year before, and was like, oh, I think we can do something that will really stand out. And I was like, okay, yep, awesome, I'll just do whatever you think because you're the expert. And I spent 4 months learning this haka from Kiriyama, which was so far out of my comfort zone. And everyone else there did like a pretty dance, and there was like another pretty dance and more pretty dances, and I did this full-on haka, which I was really proud of, and I've spent a lot of time learning. And then I I don't know if it was stupid or not, I posted it on my Facebook page, and I was like, no one's even going to care, because who really cares about Miss World anyway? And so I posted a video of my Facebook page, and the next day there was like 500,000 views of the video, and like all of these comments, some of them were like really nice, and then some of them were like, I had like death threats, I had like people were like, you effing idiot, like how could you, like you're like, pretty much everything bad that you can think of was said in the Facebook comments. And then the like TV1 picked up on it, and then like the Sydney Morning Herald picked up on it, and then the Daily Mail picked up on it, and there were like memes circulating about me. And so this was like, I don't know, I've never been through a kind of media storm. And I guess one good thing is that no one would recognise me. People wouldn't see that and then recognise me and put two and two together. But it was really hard having people say like really horrible stuff to you, especially if such as something that I felt like I'd really put myself out there to do. But anyway, I've kind of moved through that, and still learning the haka was my favourite thing of going to Miss World. And over there the contestants loved it, and I got to do it again at a smaller performance. And I just think it was really kind of eye-opening to see how strongly it polarised people and how divided people were over it. And if I offended people, I really didn't mean to do it, and I had done it from a really genuine place. And I made a commitment when all of this media kind of storm came out that it wouldn't put me off learning more about Māori culture and learning about te reo And last year I met this American consultant who is the first person that I've seen use Te Reo in his consultations. And to me, that was so inspiring. So this was I did a psych run, and he would open his consultations with karakia if they wanted to. He would frequently use Māori words in his consultations, and he'd close with karakia. And you just saw with Māori patients that barriers were broken down, people felt like they could relate to him. And this is an American consultant. So I found that really inspiring. So from that, and then also from this experience, and really being welcomed into the Māori community by Kiriyama, even if it was kind of met in a mixed way by the media, I've started my journey learning Te Reo with Te Wānanga o Aotearoa. And this is so awesome. If any of you guys feel like you've got free time, it's free, and so there's night classes once a week. And then after a few years, you get a diploma, and you get really useful skills which you can use to engage with people who maybe speak Te Reo as their first language or their main language. So I think for me, this is really about leadership. It's about learning from others and about leading change. So if there's something that you see that someone else is doing really well, I think leadership is just doing that yourself. You don't have to be Trump or John Key to be a leader. Okay. And my next point is leadership is continuing despite setbacks. And so last year, I very unfortunately got out of the car in the car park of the psych ward where I was working, and I just tripped and fell over. And straight away, I was in really bad back pain. And I really kind of hobbled up from the car park to my boss's office. And I was like, I think I'm too sore to work, because it wasn't just a bit sore, it was really sore. And my boss was like, I haven't had a sick day in 14 years. And then he gestured for me to follow him. And so I carried on working for about 3 weeks until I saw a physio, and she was examined my leg, and she was like, do you realise you've got a foot drop? And I was like, nah. But, but I have been falling over a lot because I've been tripping up because I had this foot drop from my back injury. Can anyone spot diagnose? There's a few prolapse discs there, isn't there? Hopefully you can spot that on the scan. So I had very unfortunately prolapsed 3 discs, not just one. And then, see here, this is a normal nerve root size here. And then this is my squashed nerve root from the prolapse here. So it's very sad. And my boss was like, you should keep working. But anyway, I finally, once I realised I had a foot drop, I saw an orthopaedic doctor who got the scan done. And then you try conservative management I think I tried it for 13 weeks, which is when you basically do nothing and hope that it will come right. But you can't, if you've got neurological deficits, which I had with my foot drop, you can't leave it too long or else they might not come right. So I very unfortunately had to have a back operation in the middle of last year, which was an interesting experience being on the other side. And so I got to try all kinds of great medications. And the day after the operation, I had tubes coming out of me everywhere. I had a catheter. And I was to my mum, I was it's been such a great day. Such a great day. I think this is just the morphine. But so after that, I ended up having 4 months off work. And then I was really lucky, and I got invited to go to Miss World at the end of last year to judge to help judge the charity part of the competition, which I was really happy about, and I was this will be great, something to look forward to after having a really kind of shit last 4 months. And so I went over there and was really excited and having the best time ever when we were pre-filming the final night. And so Miss World, I know it's not very big in New Zealand, but in other countries it's huge. And it's second viewing only at the Olympics. So over 1 billion people watched the final show. And there was this judges table here and here, and then camera crews everywhere. And so they pre-film it, so if things go wrong in the night, they just use what they've already filmed. They obviously don't film who wins. But all of a sudden I got this terrible, really bad headache. And I was like sitting there with a terrible headache, and I was like, oh, maybe it's because my hair's done up too tight, but that wasn't it. And then I was like, oh, I'm going to be sick. So I had to like run out the door, and I only just made it out the door kind of like that, but it was a much bigger theatre before, like vomiting everywhere. And then I was like, oh, I must have eaten something. And I was like, I'll be fine to go back. So I went back and like sat back down again, and then again I had a terrible headache and still feeling really sick. And I was like, oh, I'm going to be sick again. And so I got up and only just made it in front of the camera crews before spewing up everywhere in front of everyone. And so that was really horrible. And so I went to hospital in the US after 3 days in the hotel, not being able to stand up without vomiting. And it's a really different experience in the US. I turned up and had vomited twice in the waiting room. And they were like, oh, do you have health insurance? And so I had to ring the health insurance. They were like, we won't see you until we know that your health insurance will cover this. And so I had to look up. I was like really sick. I'd been vomiting for days. I had to look up, call my health insurance. They had to speak to my health insurance before I was even seen. And then I got admitted. I had a CT head straight away, which is probably quite American. And then they didn't really do much, and they were like, oh, we think you've got some kind of viral illness. And they discharged me back to the hotel by myself at 4 a.m, which is like pretty dodgy, and I hope that when you guys are working nights in Masterton or somewhere that you won't do something like that. And then I basically kept vomiting every time I stood up for the next 2 days, and I was like, well, I just have to come home because I can't go back to that crap hospital. And so I flew back a 5-hour flight to Los Angeles and then a 13-hour flight to Auckland, and it was like so terrible. I had this terrible headache and was spewing, and I finally went back. I came back, and then I kind of lay around over Christmas, and when I lay flat it was okay. So I was like, after Christmas I just laid on the couch for about 4 days over Christmas, and then I went back to work, and the first thing I did back at work was promptly vomit an ED while we were seeing a patient, which is like not a good look. And so then I got admitted under the consultant that was on, and it turns out that I had a CSF leak as a delayed complication of my back operation. And so then that got patched up, and I was in hospital over New Year, so that was like pretty lame. But I'm doing so much better now, and I think another thing is that leadership is really continuing on despite setbacks. And if someone had told me now that, or like if someone told you that you're going to have a back operation and then you're going to get sick overseas by yourself and then you're going to have all of these things, you'll be like, oh, that sounds like too much to handle. But you can get through way more than you think if you have to. And it was a bit unfortunate. So when I finally went back to work after all of this, the first thing my supervisor said to me, he was like, oh, you realise you're going to fail the run because you've had too much time off. So yeah, I failed that run for having too much time off. But I really think that that's another example of what we can all do, is even if we've got setbacks, if we get sick, if we have complications, not only complications medically, but if complicated things happen in our lives, if we have breakups or whatever, all you can do is just carry on, and I think that that's another example of leadership. And another thing that I think about leadership is it's about being proactive. And it's about seeing problems and thinking what we can do as normal Kiwis to fulfill these problems or to create change. And when I was in my second year of uni, I was tutoring quite a few people, and this guy that I thought was kind of awesome was also tutoring quite a few people. And we were like, oh, let's put our tutorials online. We'll make a website and we'll put them online. And so we did that. And we thought that only the people that we were tutoring would use the tutorials. And so we were like, would have been delighted if 35 people had watched the tutorials. But we made tutorials for, I think it was just level 1 algebra, and put them up 4 weeks before the maths exam. And within that 4 weeks, 3,500 people had signed up to our website, which is pretty awesome, we thought. LearnCoach, I don't know if any of you guys have heard of it. You're like, 1, maybe 2, yes. Good, awesome. And so basically what we do, and then from that LearnCoach started. And so we have a website that delivers free tutorials to NCA students. And so we kind of believe that there's huge educational inequalities in New Zealand. And I was really lucky through school that my parents would pay for extra tutoring and that I could pay to go on a UMAC course, which was a complete rip-off and costed like thousands of dollars. And I still got a pretty average mark anyway. And so we really think that all students, no matter of how much money they have, that they should be able to have help, and when they go home feel like they can start somewhere. And so that's kind of the idea behind what we've been doing so far at LearnCoach, which is online teaching. And then we've been thinking over the last few years, how awesome would it be if not only can kids watch free tutorials and get help, but they can get credit for the help that or for the work that they're doing outside of school. And if kids are sick and miss school, or if kids are awesome at sport and overseas doing sport internationally, or if kids, for other reasons, can't go to school, how awesome would it be if they could sit assessments through us online, and then we can give them credit for this through NZQA. And so over the last kind of year, and a lot of the stuff that I did when I was off work with my sore back was applying to NZQA to get accreditation for online assessments. And that went through, which we were really surprised about it, because surely NZQA wouldn't want us letting students do online assessments, but we've met with the CE and they're really excited about this. We had to make a lot of anti-cheating software so that people won't cheat, because obviously people as smart as all of you guys wouldn't need to cheat, but you might be smart enough to realise that it's easier to, but you won't be able to with our systems. So how it will work is students will watch a video playlist online and then learn about the assessment, and then they can sit the assessment online, which is pretty awesome, and then we'll mark them and moderate them and send them back to NZQA. So that means that students who are sick, like I said, who are sick and can't go to school, or students who live in rural communities and don't have like a physics teacher, could do physics through us. And this is something that we're really excited about and have been working on a lot. And we hope that it will really work to level the playing field of education in New Zealand, which is something that we're really passionate about at LearnCoach. And if any of you follow LearnCoach on Facebook, you'll know that my good friend Dean Watson, who's a comedian and writes for 7 Days, does our social media. So if you don't like the Facebook page already, you might get some good laughs from our Facebook page. So, in summary, what is leadership? And I think leadership is about being involved, sitting at that table like the Trump table, even if it feels like the people at the table aren't like you. And it's about standing up for our patients, like I did with my friend who had very unfortunately had that really bad facial burn. It's about learning from others and leading change, like I experienced with the haka and with Kiriyama, and now that I'm learning te reo. It's about carrying on despite setbacks, like I very sadly had to do because I hurt my back last year. And it's about being proactive. So when you see a problem or see something, don't think that you can't because you're just a med student or you're just a normal Kiwi person. If you surround yourself with people who are like-minded and dedicated and passionate, you'll be surprised, just like I've been really surprised, about the kind of things that you can go on to achieve. So yeah, those are kind of my thoughts on clinical leadership. I'm really open to have any questions at all, but thanks so much for giving me the chance to come and talk to you all today.
Thank you so much, Deb. That was really inspiring.
Thanks.
And yeah, I'm sure we've learned like a few pointers and things. So thank you.
Thanks.
Any questions?
How did you deal with the critiques when the video went up, let's say, for the haka?
Oh yeah, it was pretty grim, to be honest. So when I realised it had kind of gone a bit crazy online, I had to take a month off social media. So I just turned my Facebook off. I was like, I really don't need to deal with this kind of negativity. So I'm really happy to take constructive criticism where it's from a well-meaning place of like me understanding more or doing a better performance. But I think a lot of that was not very constructive. And I think the other really important thing was not engaging with trolls on social media. So I didn't reply to any comments, and I think after about 4 days, this was awesome, Kiriyama wrote this really epic reply on Facebook which got over 1,000 shares, which really defended me and kind of said that I'd done it from a really genuine place, which was awesome because he could have been like, nah, it was all her fault or something. But he really stood by me. And then about 3 days later, I thought really carefully about what I wanted to say and then posted that online. So I just basically said that I had done it from a really genuine place and that I loved learning it, and that I think that it's a real shame if this is how some people would respond to someone who's making a real effort to engage, especially in a country where we have such huge education and Māori inequalities. And then after that, a few people, not a lot, but a few people emailed me or Facebook messaged me and was like, oh, I'm sorry, I didn't really realise. But I think, yeah, key is just being really thoughtful about what you post online, and that it's often not worth engaging with trolls. Yeah.